Hi, everybody. We're going to talk about TPN or total parenteral nutrition. And I wanted to start out by just giving you a few little facts here. And then we're going to actually, what I think we're going to start out doing is we're going to look at what is this? Okay, what is total parenteral nutrition? And so let me shrink this tiny bit here. This is when a patient can't eat for more than 5 days or more, for 5 to 7 days, I think. And we can do this one of two ways. We can put it in a PICC line, and if you'll see, the line goes in up through this vessel here, and the tip of it sits right here above the right atrium. Or we can do a central line, which is just a little further up the line, but the tip also sits here by the right atrium. And this is the person's nutrition. The pharmacist actually makes this nutrition specifically for the patient, puts it into this little bag, which we'll talk about. And the patient can't eat orally, so they must give it in a large bore vessel because of the high content of sugar that is in it. And this is why we have to either put it in a PICC line or we have to put it in a central line. Now, you know that there could be some problems, with infection because of how that tube is in there. And if you think about it, the end of it sitting right above the right atrium of the heart. So we've really got to watch a couple things when we're using TPN. Now, if you look, it says usually indicated in patients whose GI tract is not functioning, who won't be able to eat for 5 to 7 days. Okay. Um, Different disease states may require TPN, so it's just based on what type of disease they have, and then maybe some hypermetabolic states. There, so there may be some ethical issues, maybe aggressive use of TPN there. But here's what I want you to see. Subclavian central line is a dedicated line. You don't put anything else in it. When you use a PICC line or a central line for this, it's specifically for this. And sometimes what just needs to happen is we need to give, and like it says a bowl, sorry, it should say the bowel here. We should give the bowel a rest, and I should have an E there. But the thing about TPN that you have to remember for your boards, and maybe even for this exam, is that TPN has a high content of sugar, and it will raise blood sugar. We have to do blood sugar checks every 6 hours, and we may even have to give the patient insulin to help bring sugar down. So we may have to treat them kind of like a diabetic because of this high content of sugar. All right. So it says it's a 2 nurse check, but here's the thing. Check that there are no crystals. I'm going to say probably 2 nurse check for insulin too. Check that there are no crystals, cracks, or oily in the actual TPN solution. And it says don't hold it up to light. I don't know if some of you noticed, but in the hospital, if they're giving TPN, it kind of has a dark cover over it because light can affect it. And it's got sensitive nutrients in there. It is light sensitive, and it will have that dark cover. Now, here is a really important thing. Let's say the pharmacist made TPN for the patient, and the TPN's running good. We're checking blood sugars. We're giving insulin as needed, according to their sliding scale. And then all of a sudden, we don't have TPN anymore, and it runs out. What we're really worried about is this patient's blood sugar is very, very high while this TPN is in, and then all of a sudden it runs out. We don't have anything to replace it. So you must have something by the bedside. It's called D10W, which is a high content of sugar, right? Dextrose 10% in water. And it says if it does, we're going to use dextrose 10% in water to hold the patient over and just keep their sugar steady to avoid hypoglycemia. It's very important. TPN will stay in the fridge until it's ready to use, but you never microwave it. You're going to, warm it to room temperature. You're not going to put that cold TPN in there. The big thing here is you have to change the tubing daily. And then it says dressing changed every 7 days, sterile technique. The tubing can crystallize, so we've got to take and every 24 hours change the tubing. we're watching I's and O's, we have to slowly taper them off TPN when they're ready to be off of it because of the high content of sugar. Flush with 10 ml syringe only, must lock the line if we are going to, you know, not have anything we worry about an air embolism with TPN because of where it's positioned inside of that great vessel. Crackles, check edema, bounding pulse, may have hard candy, but no mints for the doctor. If liver enzymes are increased, not breaking down the amino acids, that's another thing we have to watch when we give TPN, is that the liver enzymes may go up because there's some amino acids that are in the TPN and they may not break them down. Uh, Bag good for 24 hours. After that, you must replace it. So we're just going to go over this, then we're going to go to your book, okay? So what is our goal for TPN? Is to improve some nutritional status and establish positive nitrogen balance in the body. I don't know if y'all remember from intro or level 1 when you talked about how important it is for a positive nitrogen balance to heal. And that's important in the body. Maintain muscle mass, promote weight balance or weight gain, enhance the healing process. Those are some goals, right? Now, look over here where it says contains. Contains a high concentration of dextrose, electrolytes, calcium, phosphorus, magnesium, sodium chloride, amino acids, and lipids. This contains a lot of things that the pharmacist puts together specifically to maintain life for the patient. There are some complications though, and don't look at this page number. That is an old page number. But what we do worry about is something called a pneumothorax. Remember at the first, I showed you that picture of when you are the line and where it sits here. We can actually, anytime you put a line in someone, doesn't matter if it's in the vein, the artery, or the esophagus, or the rectum, we could puncture that and we could cause what's called a pneumothorax. We could by pulling this out, there's a certain way we're going to remove a central line to avoid an air embolism, but we could have an air embolism. We could also get septic. They can get an infection. Not only are we in that big vessel, but we are also having a high content of sugar, which loves bacteria, right? So we have to worry about sepsis. We have to worry about hyperglycemia. We do also have to worry about fluid volume overload because we're pushing a bunch of fluid into that system. And then we do have to watch for rebound hypoglycemia, which means their sugar's going too low. So we're going to watch the sugars really, really carefully. Now, who do you think might need to be on TPN? Though somebody who has significant weight loss, maybe a decrease in oral food intake for greater than a week, muscle wasting, decreased tissue healing, abnormal urea, nitrogen excretion, persistent vomiting, diarrhea, and hydration. So those are some reasons that we would probably put them on this. Let's look at our Lewis Medical Surgical book. You'll see there's a table in here, and I don't know what she has told you to read. I don't have that list in front of me, but I do know that I think you have between 3 and 4 questions on the test about TPN. Let's just look at some of the things here. And it says PN solutions, which it really means TPN solutions, must be prepared by a pharmacist or trained technician using strict aseptic techniques under a laminar flow hood. So they're going to put it together. You don't really need to know that, but there you go. Add nothing to TPN solutions after they are prepared in the pharmacy. So we're not going to put anything else in them. The pharmacist prepares them. Limit the number of people involved in preparing and administering TPN to reduce the risk of infection. And TPN solutions are ordered daily to adjust the patient's current needs. TPN solutions labels shows the nutrient content. So when you're looking at the label on it, it shows what nutrients are in there. It shows all the additives, the time mixed, and the expiration date and the time. I think that's kind of important to know. If you've never given it, you want to know what's the label on there for, right? Solutions are good for 24 hours. That's important to remember. Remember, we change the tubing every 24 hours and the solution, and it must be refrigerated until 30 minutes prior to using. Okay, so now here we're going to maintain, we're going to be the ones that are going to actually maintain this TPN line. So we want to follow proper aseptic techniques to reduce the risk of infection. I don't know if she's going to ask you like 0.22 micron filter with TPN solutions not containing fat emulsion. I don't think that's super important for us right now, but we are going to use a certain type of filter. Change filters and IV tubing with each new TPN container every 24 hours. That's important. Okay, I would star that. Label tubing and filter with date and time that they are put into use. Very important. How do you know when 24 hours has gone by if you don't do that? If a multi-lumen catheter is present, use a dedicated line for TPN. Remember, TPN is only in its own line. Okay. Do not draw blood from a line dedicated for TPN unless you have no other option. Control the infusion rate. Give TPN using an infusion pump. Set an alarm to alert for tubing obstruction because sometimes the tube gets a little obstructed. Periodically check the volume infused because pump malfunctions can change the rate. So we're going to do a lot of checking on this patient. Now let's look at the patient safety. I do think this box is kind of important for you to look at in your book. Before starting TPN, check label and ingredients in solution to make sure they match what the healthcare provider ordered. So you're always going to check. It's like giving a medicine. A second RN should verify infusion pump settings before beginning. That's pretty interesting. Trace the administration tubing to the point of origin in the body at the start of the infusion and at the handoffs. I don't think they'll ask that, but you want to make sure you trace all your lines. Where are they ending? Where are they starting? What does the skin look like, when you start it and when you hand off to the next person? Check the solution for leaks, color changes, particulate matter, clarity, fat emulsions, cracking. Sometimes fat will inside of this TPN will crack and separate into layers. If present, promptly return it to the pharmacy. So we're not going to keep it if it's having all that issue. Discontinue a TPN solution and replace it with a new solution if the bag is not empty at the end of 24 hours. At room temperature, the solution, especially when containing fat emulsion, is a good medium for microorganism growth. Did you see that? We worry about the risk of infection because when it contains fat, guess what? And sugar, I'm going to put sugar there too. You got a really good bacterial growth farm there. If fat emulsions are infused separately from the PN solution, the preferred delivery method is continuous low volume delivered over 12 hours. The big thing I think here is we're going to check it, and if it doesn't look right, we're going to send it back to the pharmacy. There shouldn't be any particular matter, in it. It should look normal. And you got to replace it every 24 hours. Now, here's a big one. We did mention this, hyperglycemia. Remember, we worry about blood sugars, hyper and hypo. So we're going to check the glucose blood levels at the bedside every 4 to 6 hours with a glucose testing meter or glucometer, right? And we are going to try to maintain our sugars. Now, in the book, it says 140 to 180. And then we have to, if we're going to, if the sugar's going any higher, we're going to give sliding scale dose of insulin to keep those glucose ranges in that 140 to 180 range. I know it's not normal, that's not the normal range, but when you're on TPN, it's a high content of sugar, so you're very lucky if you keep it 140 to 180. Okay, now hypo, if a PN formula bag or TPN formula bag should empty before the next solution is available. Y'all better know this. This is something that the boards want you to know. You need dextrose 10% in water or 10% dextrose solution. And it says or 20, but they usually like to ask 10% dextrose in water. So they give you options on this one, but I would stick with the 10%. So we are worried about catheter infections. We're going to just look here, carefully assess the site for signs of inflammation and infection. Phlebitis, which is inflammation, can readily occur because of the hypertonic infusion. This is actually considered a hypertonic solution, and it can shift fluid around in the body, so be very careful with that. We want to look at what are some catheter-related infection signs. Just look at locally, we could see erythema, like redness, tenderness, exudate at the site. Systemic manifestations would be fever, chills, vomiting, and malaise. So just be aware we worry about infection. Uh, if you're a immunosuppressed patient, you're at high risk for infection on top of that, because you're not only receiving this fat and this sugar, but you're getting chemo or steroids or antibiotics or something like that. To reduce the risk for infection, catheters with antibiotic or aseptic surfaces may be used. Let's look here. If you suspect an infection during a dressing change, send a culture specimen of the site. And then if a catheter-related infection is suspected, blood cultures are drawn, a chest x-ray is taken to check the pulmonary status. All right. Let's see. Encourage oral nourishment and keep a careful record of intake. Begin with clear liquids. Let's look down here. I want to see, weigh the patient. Here's where we're going to assess effectiveness. You want to make sure you get vital signs every 4 to 8 hours. Weigh the patient daily as a measure of the patient's hydration status. We've got to keep them hydrated. And we also maintain an accurate intake and output. Determine the cause of weight changes. Remember, we could have fluid overload. We also want to assess a really good assessment of our blood glucose, electrolytes, and urea nitrogen. And then we do a CBC and a hepatic enzyme are obtained a minimum of 3 times per week. So just make sure you wear. There are some complications that go along with TPN. I want you to look here that I don't know that you're going to have to know all this, but it's just kind of nice to know if you're giving TPN that we could have some liver dysfunction. Remember, we were talking about that. Maybe the liver can't handle or metabolize some of these amino acids, and hyper and hypoglycemia and hyperlipidemia, and like all these things right here. So we do have to worry though, because this is a catheter, and remember, the tip of it sits right above the right atrium. So these are some things we worry about: air embolus, sepsis, it coming out, hemorrhage, occlusion, phlebitis, which is inflammation, pneumothorax, hemothorax, or hydrothorax. Probably pneumothorax is what they're going to talk about. And then thrombus of the vein or blood clot. So be aware that these are going to be some problems. And we can go back to my notes. Let's go back up here. And I want you to look down here. These are very important things. When would you place a patient on TPN? At least 5 to 7 days without eating. We might have to do it to give the bowel a rest. Look, you could say bowl rest, but that's not correct. But the big important thing here is checking that insulin. Remember, we said hypo and hyperglycemia. Make sure that it doesn't get any light, because it can destroy the nutrients. Look, 2 nurses need to check. It says take it out of the fridge 30 minutes prior to giving it. Remember, in the book it said that. We're going to change the tubing daily, and we have to change the TPN, only lasts for 24 hours, but dressing changes every 7 days for sterile technique. And remember, we got to taper off. So go through this and pay attention to what is TPN. 3 to 4 of your questions are going to come from this information, and I think I've covered some of them on here. So make sure you know what you're looking at when you give TPN. I hope that this is helpful for you.